Now, thank you for joining us. This is our final presentation of the open enrollment period. And this is Health Equity WageWorks. They are responsible for managing our flexible spending account or FSA plans. So I will turn it over to Mr. Steve Rivas. He'll be the presenter today. I'm going to ask that everyone hold questions until the end. Stay on mute, please, during the presentation. And if you have any questions, feel free to put them in the chat. All right.
Awesome. All right. Well, hello, and good afternoon, PGCPS. Thanks for joining today. Of course, a little bit late, but we got going here. So we're going to help you learn how to save with a health equity, healthcare flexible spending account, and a dependent care flexible spending account. Again, my name is Steve. So we got a lot of good information for you. Let's go ahead and get started. So first, we're going to be looking at a flexible spending account, an FSA. Now, a healthcare flexible spending account allows you to pay for many important healthcare expenses. This is from doctor visits and dental work to glasses, contacts, and prescription medication. So that list of eligible expenses does continue to grow. It also may include products not covered by your health insurance plan. So in fact, I don't want to say recently, but in the recent past, new legislation in March of 2020 made FSA funds eligible to pay for over-the-counter medications like pain relievers and cold medications without a prescription. So as well as feminine hygiene products. So today we're going to be specifically talking about how this healthcare flexible spending account will be working together with other types of accounts that we have as well. Now, one of the main benefits of using a flexible spending account is the tax savings, of course. So funds contributed to the account are deducted from your earnings pre-tax, thereby lowering your taxable income, and you are paying this way you aren't paying those federal income tax on your FSA contributions. Now, an additional benefit that an FSA provides is that the full year election amount of your FSA funds is available for your healthcare expenses starting on day one of your plan. So this means that you can feel secure knowing that you have that money in your FSA in your pocket, ready to pay for those eligible expenses. Now you can find a list of qualified medical expenses to spend your funds on the website you see on your screen there. That's the healthequity.com/QME. That QME stands for qualified medical expenses. So this is just a sample list. Of course, there is a full extensive list on that website for you. Now, most healthcare accounts have contribution limits. So the maximum contribution limit for the FSA is $2,850. So that's a tax savings of over $500. So do keep in mind that if your spouse is contributing to a health savings account, you may not qualify and be eligible to contribute to an FSA. Now, your company does offer a carryover, letting you roll over up to $570 in unused funds, and that's from one plan year to the next. So in order to set up your flexible spending account, you want to take the time to estimate your anticipated yearly eligible healthcare expenses. Usually some examples, folks may wear glasses or contacts or both. So you have the cost of your glasses, cost of your contacts, your contact solution, medications that you may be getting, prescriptions that you get on a regular basis, etc. So you want to take those things into consideration, and then you want to choose your election amount during open enrollment to cover those expenses. So remember, you generally can't change your FSA election amount during the plan year unless you have a qualifying event. So it does pay to plan ahead and plan carefully with the dollar amount that you want to contribute. Remember that you need to use all of your FSA dollars within the plan year, or you will forfeit those funds, again, unless there is a carryover option. So anything above that carryover option, you may forfeit those funds. So with so many available products, it's easy to use your funds to purchase the items that you need. Rest assured that you can use your healthcare flexible spending account with a dependent care spending account, with commuter benefits, and with a health reimbursement arrangement. So it can be paired with any of those. So check with your employer to see if you have any other types of tax savings accounts that are offered that you can add along with a healthcare flexible spending account. Now, having these accounts allow you to feel prepared and secure in order to handle any medical or general care needs. And at the same time, you're saving money by doing so. So just remember that your healthcare flexible spending accounts cannot be used if you or your spouse is already contributing to a health savings account. Only a limited purpose FSA is eligible to be paired with an HSA qualified plan. Now, if you have yearly medical expenses, like I mentioned, some of those every year items that you're typically paying for out of pocket, an FSA might be the right enrollment choice for you. So decide how much tax deductible money you'd like to have available at the beginning of the plan year and start contributing. If you would, you can please download and install the Health Equity mobile app for easy access to all your accounts. That'll help you with eligible expenses, filing claims. That app does quite a bit, so you check that out. So now we're going to go ahead and switch over to the dependent care flexible spending account known as the DCFSA. Now, of course, as parents and caregivers, everyone has a lot of responsibilities. So especially if you work or go to school, maybe full-time or both, school and work, which is common for nearly all US families. So despite the increasing need for childcare, paying for quality childcare in the United States is actually becoming more and more difficult. And this is according to data from a Lending Tree report. Now, according to a Forbes article, using some additional data from another Lending Tree report, across the United States, parents are seeing an average annual cost increase of 41% for center-based childcare providers. That's a huge jump. So folks are spending an average of $14,117 annually, and that's up from $9,977 pre-pandemic. So that's over a $4,000 increase. So these DCFSA accounts can help you save, at least on the tax side, using those pre-tax funds to pay for these expenses. Now, a dependent care flexible spending account, a DCFSA, also known as a dependent care reimbursement account, is a pre-tax benefit. So it can help you pay for those eligible services for your loved ones that you claim as dependents on your taxes. So some things you can use the DCFSA for are preschool, summer day camp, before or after school programs, and child or adult daycare. So it's really smart way to use those pre-tax funds and save money while taking care of your loved ones. Now, the money you contribute to a dependent care FSA is not subject to those payroll tax and income taxes. So you end up paying less in tax and taking home more of your paycheck. Now, childcare, as I'm sure you may know, is not eligible for reimbursement under other healthcare accounts, but it is with the DCFSA, and you can pair it with those other accounts. So in fact, contributing to your healthcare accounts, including a health savings account, healthcare flexible spending accounts, and health reimbursement arrangements to pay for your healthcare needs while also contributing to this DCFSA. So there's a number of eligible expenses that you can use your funds for to care for your children who are under age 13. So you may also use the DCFSA funds to pay for care for your spouse or a relative who is physically or mentally incapable of self-care and lives in your home. So we do encourage you to review your plan documents carefully and consult your benefits team for a list of potential eligible expenses. Now you can easily search for eligible expenses to use your funds on at thehealthequity.com/learn/dependent-care-expenses. So another quick side note, the first website, healthequity.com/QME, on that page, there is a link to all of the eligible expense plans. I should say link to each plan and their eligible expenses. This is just simply a shortcut directly to these DCFSA eligible expenses. Now, because DCFSA must be used to help care for a dependent, that you claim on your taxes, so that's how you know that they're eligible, is they're a dependent that you claim on your taxes. DCFSA contribution limits are determined by your tax filing status. So the contribution limit is $5,000 per household. Now, if you're married and filing a separate tax return from your working spouse, each of you can contribute up to $2,500 each per year. If you're married and filing together, joint return, then you can contribute the $5,000 per year as a household. Note that if your spouse is a stay-at-home parent, then you cannot participate in the dependent care FSA. You and your spouse must both be working or have eligible student or disability status to participate in this benefit. Now, things have changed a bit. So childcare payments to relatives will qualify unless the relative that you're paying is under age 19 and is the employee's child, stepchild, or eligible foster child. So they will qualify unless they're an individual for whom the employee or spouse can claim an exemption on the IRS Form 1040. And they're eligible unless they are the employee's spouse or a parent of the employee's under age 13 qualifying child. Now, your company offers a grace period, giving you an additional 2.5 months to use the previous year's DCFSA funds. So you got an additional 2.5 months there to use those funds just in case you don't use them in the plan year. Now, you may only use the DCFSA funds that are currently available in your account, not what you've elected for the plan year. So let me explain. As you contribute and those go into your plan, you're able to use those tax deductible funds and get reimbursed. Here's an example. If your care facility requires you to make a full year tuition payment at the start of the year, but this is before you've contributed your sufficient DCFSA funds to cover it, you will be reimbursed up to your account's current balance at the time services are rendered. And then the rest of your claim will be held until your account is funded and services for that period have been rendered. Then you'll be reimbursed for the remainder of your claim throughout the year. Now, unlike most FSA plans, the DCFSA may provide you with flexibility to make the mid-year changes if you have a qualified life event. So you will want to discuss with your plan administrator which of these following items may be allowed for you to make a mid-year plan adjustment for. So on your screen there, you'll see a change in marital status, such as marriage, a divorce, or death of a spouse, a change in the number of your dependents, such as birth or adoption of a child, a change in employment status for you, your spouse, or a dependent that affects eligibility, and a change in residence for you, your spouse, or the dependent. And then lastly, a change in childcare or elder care provider, a change in cost, or a change in coverage. So you want to make sure that you save all your receipts for any of these accounts. You will need them for any reimbursements and to validate your expenses in the event of an income tax audit. So it's important that you use your funds before your plan year ends for the qualified expenses, or you lose those funds for the DCFSA. Now, during your open enrollment, consider signing up to participate in a DCFSA and determine the amount you would like to contribute to that plan throughout the year to pay for your eligible child care or elder care expenses. And whatever you do choose to contribute, we make it easy to use those FSA and DCFSA funds. Remember, we've got our mobile app, or you are more than welcome to call our member service team. They are available for you 24/7, 365 days a year to take those calls and respond to any questions that you have about your health equity accounts. So there was a mention of some questions at the end here, so we'll go ahead and get to those. I guess I'll have, if you've got questions directly for me here at Health Equity, I'm happy to hear those and we'll get those answered for you as best we can.
Thank you so much, Steve.
Yeah,
Great
absolutely.
presentation.
Appreciate it.
So does anyone have any questions?
Yes, I on the county webpage, it has for next year, the limit is going to be $3,050 with a carryover of 610, but that's not what Mr. Rivas just stated. Is that accurate or?
So those may be those. I think those are actually the 2023 limits. Um, what I so the presentation created, generated, and everything probably prior to those numbers coming out, but I'm sure we can get confirmation on what's actually going to be.
Okay, thank you.
Yeah, absolutely.
Yes, and I will say, yes, unfortunately, the IRS did not set the new limits for 2023 before we opened or had our open enrollment. So we had to go with the old or the maximum amounts for 2022. However, we are going to use the newly announced limits for 2023. I don't believe that employees can elect that amount in Oracle. I think what'll happen is if you elect the maximum amount that's set in there, the 2750, that after open enrollment closes, that the IT team is going to go behind the scenes and increase everyone who elected the maximum amount to that 3050, and then you'll receive an email notification that it's been changed. That's my understanding.
Okay, and if you didn't want it to change, does the employee have an option to keep it at the old amount?
I think when you get when you receive the email that it's going to, or it's been increased to the maximum amount, you can respond and request that it not be, that it be changed back to the, the original amount that you had put in.
Okay, thank you.
Yeah, the assumption is if anyone requests the maximum amount, that they probably would want the maximum when it changed to that 3050. So that's why they just kind of do it automatically. And then folks who don't want that can certainly let them know. A great question. It
Yeah,
happens every year.
absolutely.
It happens every year. The IRS always publishes the amounts after our open enrollment begins. We did the same thing last year. So, and like you said, Steve, that I think when you guys prepared the PowerPoint, it hadn't been announced yet for the updated
Yeah, it was
amounts.
just recently that came out. So
Yeah,
we
just
were
late last week. Yep.
exactly, yeah, a little behind the ball there, but that's all right. It'll all
Yep.
work itself out.
Great. Thanks. Any other questions?
Keep in mind, folks, if you remember something after this is over, then you're welcome to call that number on your screen. You don't have to be a member. You don't have to be enrolled in something to call and talk to the team and say, hey, I'm thinking about doing this. What should I do? Which plan should I, they'll guide you as to what your best options may be. And then this way, it's a preemptive thing for you to make a better decision for your choosing the dollar amount that you want to contribute. So don't be shy about calling and asking questions, even though you haven't enrolled or signed up yet.
Yes, great point. And the information is also on the benefits webpage as well. I'll also take a moment to remind everyone that open enrollment does close tomorrow. So certainly, we've had it for a little over 2.5 weeks. So you do have, about 24 hours or so to make your decisions regarding your FSA plan deductions. If you want to enroll, enrollment is done using Oracle Employee Self-Service, and you can access the enrollment information from outside of the PGCPS network during open enrollment, as long as you have an internet connection. Once open enrollment closes, you can only access the benefits information when you're within the PGCPS network.
Excellent. Yeah, don't be afraid to try out the program as well. You don't have to max these programs out. So for those that are just trying it out for the first time, take into consideration what you purchased last year, health medications, or if it's dependent care, what you spend on some dependent care, and try it out, see how it works for you. And then maybe for 24, you might be able to bump that up and take, full advantage of the program. But it gives you an opportunity to try it out and see how it works for you. And
Yep.
just in case you need the eligible expenses website again, it's healthequity.com/QME.
Great, thank you. All right, any other questions before we end the meeting?
Whoa, not sure what happened there.
It's all right. So not seeing any questions. I
I'm
think
sorry.
we're,
Something happened with my internet here. I have a question. Because this is my first time doing it, and so what is the percentage for a first timer to put into the FSA? Like, what is the percentage that you recommend? Because like me, I'm using glasses. I go to the doctor every 3 months. I buy my medications every 3 months. So
Well,
So-
the best thing to do is, sit down and make a list of those expenses that you have. So you may want to total up your prescriptions.
mhm,
And if you know you're going to visit the doctor at least quarterly, so that's 4 visits,
mhm,
what do you pay for each visit? We're just going to use some examples. Let's say when you visit, you pay $50 per visit.
it's,
So that's, yeah. So, it would just be $200 for that. If you pay $50 per your prescriptions and you buy those once a month, that's $600 plus the $200. So you would want to contribute $800 to cover what you visit. So it just takes a little bit of sitting down and kind of figuring out what your expenses might be. And again, if you want to play it safe, you're more than welcome to. You don't have to contribute any more than you're comfortable with, any
okay.
more that your budget would allow. So the thing to remember is you're already going to have an expense. You're
Yes.
already going to buy your prescriptions. They're not going away.
Mhm,
Okay. Unless you get over your ailment, your expense isn't going to go away. So if you're already spending it, why spend it with post-tax money, meaning you get paid, you pay your taxes, and then you buy your prescriptions,
yeah, that's true.
when they could take it out before you pay tax, and then you paid less in tax, so you get more paycheck money going home. And
Mhm,
then what they took out before tax, you use that to pay for your prescription.
okay.
So it just takes a little bit of planning, it all is all. And for the healthcare FSA, you did have a carryover, I believe.
A
We'll go,
carrier.
yeah. See if I can get back to that on your screen for you. That's the DCFSA.
Yeah, not for me.
So there it is. So that is your carryover time frame. So they let you roll over up to $570. What that means is, let's say you put in $1,000.
Uh-huh.
If you don't spend the $1,000, you only spend 800. Up to $570 will roll
Roll
over.
over. The
So
second year.
that you don't lose it. Right. So it gives you a little cushion there for your planning.
Oh, okay.
Make sense?
Yes.
Perfect.
No, thank you so much. We appreciate it.
Absolutely. Great question.
yes, thank you. Great question and great response, Steve. Yes, the carryover is important. If you do overestimate, yeah, you can always have that cushion to carry that money into 2024 and use it for, additional eligible healthcare FSA expenses. Any other questions before we end the meeting?
Yes, I have a question. So we have enrolled in the flexible savings before, last year, and we received a Visa card, like you mentioned in the presentation, where we are eligible to start using on day one. We don't have to wait. Will we receive a different Visa card this time, or our funds will be loaded in the previous Visa that we received this year?
So if your benefits were with us and you're just going to be signing up for a new FSA for 23, then you would use the same card. So that card does have an expiration date on it. It's good for 3 years. So that card is good from 1 year to the next. At the end of the expiration, the end of the life cycle of the card, that last month, usually about the middle of the month, they will send out a new card to replace that one. So you have an opportunity to receive it and activate it before it expires.
Got it. Okay.
Yeah,
So it's
definitely
not
don't
like
get rid of the
every
card.
year. Okay, got it. So every year we don't receive a new card. It's just the one before, just before it expires, we'll receive a new card. Okay, got it.
That is correct. Yeah, I've taken those phone calls and helped folks out where they're like, I never got my new card. It's like, and they're unfortunately they thought what you were thinking along those same lines. You know, that they
Right.
at the end of the year that card was done. No, it still continues on into the next year. It's good for 3 years. So yeah, absolutely hang on to it.
Okay. And another question I had was, I saw orthodontia as listed as one of the eligible expense that we can use for FSA, for the healthcare FSA.
That is correct.
So that would, does that include braces for our kids?
It does. Yes, absolutely.
Okay.
Yeah, that's actually real common. Folks have, you know, they know in advance that their child's going to need braces, something of that nature. So they'll plan ahead for the next year's expenses, getting
Gotcha.
everything set up. So yeah, absolutely.
Perfect. All right. Thank you so much.
You're welcome.
Thank you. Great questions. Another quick reminder, we are recording this session and we will put the recording on the web page, the benefits web page within about 48 hours. So certainly you can revisit it. Actually, I'll make sure I get it up tomorrow morning to make sure folks can revisit just in case they want some more to watch it or listen to it again before open enrollment closes. Any other questions before we end the meeting? All right, well, not hearing or seeing anyone, we will go ahead and end the meeting. Thank you again, Steve, for the wonderful presentation. Thank you everyone for attending. Please remember, open enrollment closes tomorrow night, so make sure that you get into Oracle Self-Service and make your elections before the end of the day tomorrow. And if you have any questions, again, feel free to reach out to the benefits office or certainly reach out to Health Equity. Thanks again for attending. Have a great evening.
Thank you, everyone. Have a good one.